All right, thank you. Well, more dental offices are reopening, and dentists want to make sure patients are comfortable when they return. That's why some have added extra safety measures, creating a safe environment for everybody. Talk about these changes, Dr. Alan Gluskin. He is the president of the American Association of Endodontists. Good morning to you. First question would be, what exactly is an endodontist?
Well, an endodontist is a specialist who works within the tooth. The Greek prefix endo means inside, and we work within the tooth, trying to save the natural tooth for a lifetime, hopefully,
Gotcha.
When you have a toothache or a serious infection.
All right, good to know that. Okay, we got that out of the way. Let me ask you first off, you know, people are nervous to go to their own even medical doctor, general practitioner. How are dentists and endodontists and orthodontists making sure that patients are safe and that they, you know, the worry can be put on hold for a bit?
Well, the dental profession has taken extreme precautions to make sure that we protect you from us, as well as vice versa. You will notice that all the staff in a dental office now is wearing face protection. You will notice that they're washing their hands routinely, that they're wiping down surfaces in the office constantly. And if you go to an endodontist, you are going to a specialist who's using a microscope, so he can look into your tooth and be more distance from you. We don't have to crawl into your mouth anymore. 100% of endodontists use microscopes, and 100% of endodontists use rubber dams, which isolate your mouth from the dental office environment. And we protect your airway and your mouth and your throat with a rubber dam that will isolate the tooth and let us work on it.
Interesting. Okay, so I guess what constitutes a dental emergency, and how would you know if you need to see an endodontist? Would your dentist tell you that?
Well, your dentist could tell you that, but you should know that if you're woken up out of a sound sleep at night from a toothache and you can't get back to sleep, that's a serious dental emergency. If you have swelling associated with your jaw and a neglected tooth where a filling may have fallen out, or you know you have a cavity, that's a serious dental emergency. And in addition, just eating and hot and cold makes your tooth ache for 10 minutes. That is something you can't ignore, and you need a root canal specialist, preferably an endodontist.
Is there any specific thing we should do to be practicing good dental hygiene other than, you know, the brushing or flossing, or is that what we just kind of need to keep up during the pandemic?
The best thing you can do is to not neglect your mouth, and before you go to bed, brush your teeth well, and when you wake up in the morning, to get all that bacterial colonies off your teeth, to brush well. And if you can use floss and other adjuncts like a tooth, like a pick, water pick, that's all beneficial. All right. So keeping your oral health will help you keep your general health better.
Very good. Good to know. All right. Thank you so much, Doctor. We appreciate your time, and be safe. All right.